Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
No. Measurement of intraocular pressure. Measurement of intraocular pressure is mainly done with the help of a tonometry. Tonometry, first we will see the types of tonometry. Tonometry is mainly of four main types of tonometry. So, in the four types of tonometry, right, first we have applanation tonometry. First we have applanation tonometry. Second we have applanation tonometry. Second we have indentation tonometry. Third we have dynamic contour tonometry. And finally we have applanation and indentation tonometry together. Okay, so each of them has their some names, some types. Okay, in applanation tonometry, the types of applanation tonometers includes we have uh, Goldman's applanation tonometry, Perkins applanation tonometry, Magelkalov's applanation tonometry, non-contact and Drager's applanation tonometry. Then we have indentation tonometry. Then in the indentation tonometry, we have Shire's indentation tonometry. Then we have applanation and indentation tonometry. So here we have applanation and indentation tonometry. In applanation and indentation tonometry, we have the following. In applanation and indentation combined tonometry, we have Tonopen and McCarg are the both applanation and indentation tonometry. Then we have last type, which is dynamic contour tonometry. In dynamic contour tonometry, we have only one type of dynamic contour tonometry, which is called as Pascal's dynamic contour tonometry. Other type of tonometry is rebound tonometry. This rebound tonometry can be used in detection of intraocular pressure at home also. So it is a home-based technique. Then among all these tonometers, which is gold standard? Goldman is the gold standard tonometer. Goldman tonometer is the gold standard tonometer. So these are the types of the tonometer.
thank you and thank you for watching.